Hello, this is Lisa Walker-Vischer, and this is my finance presentation on my doctoral project entitled The Experience of Latino Parents of Hospitalized Children During Family-Centered Rounds. The purpose of the project is really to describe that experience specifically in a public safety net hospital in California. Family-centered rounds have become the mainstay of how we exchange information in most pediatric academic centers. They are rounds conducted at the bedside that promote the active participation of the patient and family in the discussion with the health care team. They really acknowledge that parents are the constant in the life and the importance of the family unit in decision making and promote what we call a shared decision making model. It's really associated with increased patient satisfaction and improved outcomes. And as I said before, it's a very common way to exchange information in pediatric settings. The problem is that the literature suggests that Latino parents face significant barriers to participation in family-centered rounds for a couple of reasons. The first is the language barrier, that many of our Latino families are Spanish-speaking and very much struggle with that piece in the hospitalized setting. There's also a feeling of a lack of empowerment to speak up in that more formal setting that really makes their experience different than our English-speaking families. At Santa Clara Valley Medical Center, 56% of the patients are Latino, and 37% of Latinos in the broader Santa Clara County did not complete high school. So we have significant issues with health literacy, just reading in general, those kinds of things make it more problematic also. Limited English proficiency really affects the free of exchange of ideas, and for those of you who work with Spanish-speaking families, you know that it's a very stilted process to have a conversation when you as the practitioner don't speak Spanish and they as the family don't speak English. Phone interpretation is very awkward, and while they do translate almost word for us, you have to really take your ideas and break them into very small pieces, stop, have that be interpreted, and then get your next piece and go forward. Even with trained interpreters, there are issues with the accuracy of translation, and much of the literature tells us that. Recently, there was an article using interpreters in a pediatric setting where there was a lot of filtering of information. So not that it was inaccurate, but they pared it down to the essence instead of translating all that was being said. Why did I pick this project? So as the clinical nurse specialist, I round daily in the PICU and the PEDS unit, and I was really struck by the lack of participation by some Latino parents while others participated fully. Our common scenario was the family would smile and nod through the whole thing. We'd have a Spanish-speaking person who would tell them, work with them, talk with them about that, and then they would go to either the housekeeper or a bilingual child life specialist and talk about how no one's listening to them and have all these things they want us to know but couldn't say it in that setting. And I really wanted to understand why. That didn't make sense to me, why some Latino Spanish-speaking families participated fully and others did not. I think it's really important to find ways to include all our patients and families in the care of their children and to help empower them to be advocates for their children. And then as an organization, our goal is to increase our patient satisfaction, to improve the patient experience, and to improve our outcomes, which family-centered rounds has been shown to do. So a very important project in my setting. I have a theoretical framework I'm working with, and that's called facilitated sense making. This is by Judy Davidson, and her work is done in an adult ICU, but really looked at the family members and the stress that they go through having a hospitalized family member. My application to pediatrics is that the same things apply to parents. They need to make sense of what is happening to their child. They need to make sense of their new role as a parent of a hospitalized child. For me, it fits very well into my project. There are two articles that have really driven this, and that is Cypress's literature review on family-centered rounds in general. She did a wonderful job synthesizing these articles down. They tend to have very small samples. They're very descriptive. She did wonderful work with that. And then the article that really drove me towards my Latino population was done by Seltz et al., and it really focused on the experience of Latino parents during family-centered rounds in a hospital in Denver. And that's where we found the literature about language barrier and lack of empowerment. So those are the two main articles. I do have multiple stakeholders in my project. Of course, the parents are one of the main stakeholders. We're trying to improve the communication with them as they make decisions for their child. I think the patients, the children, are stakeholders because they are the recipients of these decisions, but many of our adolescent patients participate in rounds and are part of that shared decision making also. The staff is a key stakeholder. They need to be the ones implementing family-centered rounds. They need to be the ones encouraging participation and creating a safe environment for families. And then hospital administration is also a stakeholder because they are very interested in improving that patient experience. So it's important from their perspective that we do well with this. There's also financial drivers to this project, and the main one is increased patient satisfaction and results in more dollars through HCAHPS. There's an opportunity to increase customer loyalty, which will increase the volume of patients, which in turn generates revenue, and it builds a better partnership between parents and the healthcare team, resulting in more comfort in accessing that team and better preventative care with a decreased overall cost to the system. As a public safety net hospital, we are paid pennies on the dollar we spend, and so anything that reduces that overall cost to the system while improving the health of our community becomes very important for us. This is my SWOT analysis. So our strengths are really that we already do family-centered care very well and have a good family-centered rounds program. We have a very culturally diverse population at VMC and are very proud of that, and creates a staff that allows us to work well with a diverse population. And there's a big organizational focus on increasing patient satisfaction and patient experience. The weaknesses, we have a real lack of in-person interpretation. We have very few certified interpreters amongst our staff. It's difficult to get an interpreter in person, which is always a better experience than the phone. It's all a challenge. We do unfortunately have a feeling that we do good enough for our patients, that they're not insured and that we're doing all we can and it's good enough. I would like us to strive to be giving excellent care, not just good enough. We have a lack of funding for everything from interpreters to resources. We have competing priorities in the organization, and that's really been a challenge. We're a very reactive organization. It makes it hard to stay on track doing things. Our opportunities are great. We have a growing Latino population in Santa Clara County, and we really want to attract those patients into our organization and provide them with the same care that all of other patients get within our county. No other hospital in the area markets or caters to this population, so there's an opportunity to be known as the place where you're going to get good care as a Latino family. And we really have an opportunity to work with our community partners to help us empower these Latino patients and to build trust within that community. The threats are a lack of trust, which again I'd like to build but currently probably don't have, lack of bilingual speakers to facilitate communication, and then unfortunately Valley Medical Center has a poor reputation in the community. We have very long waits in our emergency department. We have access issues, and I don't think enjoy a good reputation, although I believe the care we deliver in my units is very good, but the overall organization struggles. The purpose of this study is really to describe that experience, and then once we understand that experience, we can develop interventions to improve it. The main outcome is really improved customer satisfaction and experience as determined by our patient satisfaction scores. And success will be looking at those scores. So our scores are done by the professional research consultants. They survey a number of patients every quarter in Spanish through the telephone survey. Our goal is really to exceed that 50th percentile of excellence on selected questions related to teamwork and information, and we don't really hit that benchmark. In the past, when we implemented our family-centered rounds, we saw a huge increase in our patient satisfaction, so we're hoping this is the next step to bumping it up. The study design is a qualitative study that is completely descriptive. It's a questionnaire that was previously used in a study by Selt, so he has reworked it to make it workable. We did make minor modifications in my study, looking at separating the MD questions from the RN questions. His were, what did the doctors or nurses do about X, Y, and Z? We added some questions for nursing. When it was asked only from a physician, we asked the same question for a nurse, separated out any two-part questions into individual questions. We surveyed 20 Latino parents of hospitalized children in either the general pediatric unit or the pediatric ICU. They were randomly chosen from the daily census by myself, the researcher, based on being identified as Latino and as Spanish speaking, so very much a convenient sample of who was there on the days I worked. Spanish had to be identified as their primary language, and they must have attended at least 2 family-centered rounds so that they had some familiarity with how that process went, and that we had an opportunity to tell them about that process too. They were offered the opportunity to participate in completing the questionnaire. There was some basic demographic data collected related to, was it a mother or a father, how old were they and how old was the patient, how many days they'd been in the hospital, had they had a child in the hospital before, where did they come from, how much education they had, do they speak any English, and what did they speak at home. And then our 14 questions. So they're really focused on, tell us about your experience. How do you feel about us talking about your child? How do you feel about making decisions? Some families have been very clear with us and said, I don't want to decide that. They don't believe that's their job. They want a physician to tell them what to do. We looked at what did doctors and nurses do to help you understand the plan. And then what would you like to have had done that we didn't do? And then any other experiences, anything else they want to tell us about their experience. Data collection was completed on 11/12 of 13. 20 questionnaires were given out, 18 were returned. No one refused to participate. One was blank. The family thought they only needed to fill it out if they were unhappy. So 7 surveys are in the process of being translated, and I actually got them back today and haven't had a chance to look at them, but I'm excited to see what I've got. My timeline has shifted a little. It took longer to get through, not my IRB, but there's an administrative approval that had to happen. So I'm in the process of developing some materials to give out, but I need to look at my data before I can finalize those and then implement that and then work with my nursing staff about some empowerment techniques. So we're going to look at our existing customer satisfaction data pre and post to see if we can see an increase. The surveys have been translated. We're using a process called content analysis, which uses a deductive approach to look for common themes. So it's a process of reading and rereading, looking for key terms or looking for common themes between the questionnaires. See what we identify on our own and then compare it to that work of Seltz et al. And see if we have the same thing in our population or if it's different. I'm hoping there'll be something new in it. We'll see. So based on these questionnaire results, a parent handout's going to be designed. We are going to have it reviewed by a group of Latino parents. I've done that with a couple other things we've done in our unit, and it's been incredibly eye-opening to see their perspective. I think I've written it all warm and friendly and inclusive, and then they'll come back and say, oh, that sounds really cold. Great, great feedback. So I have a group of 5 parents that are going to look at it for me. And then I have to really work with the nursing staff to teach them skills to empower parents to feel comfortable with their role in participating in family-centered rounds. We're really going to look for resources for interpretation during rounds. Right now, rounds are conducted in English, and then either the interpreter phone is used or a Spanish-speaking staff member gives them a summary, asks for their input. But again, we spend 20 minutes talking about a patient, and then we give them 2 lines. It must be very disconcerting for them. And then we're going to use Lewin's change theory of plan change to engage the staff. Right now, I don't think the staff sees this really as a problem, and that we're going to have to create some urgency to get them to see that. So in conclusion, Family Center Rounds offers a formal way to exchange information and supports a shared decision-making model. Very important in pediatrics, very much the standard of care. We do believe that Latino parents face significant barriers to participating in family-centered rounds, and this project attempts to describe that experience and to implement a plan to minimize those barriers. These are my references, and thank you so much for reading to the end. Have a good day. Thanks.